The Finance Committee's health care bill about to move now to the next phase. A lot of people wondering who the key players will be once this legislation hits the full Senate. Live with us from D.C., one lawmaker considered one to watch, Republican Senator Susan Collins of Maine. Good morning to you, Senator.
Good morning.
Fairly or not fairly, a lot of times you're lumped together with Senator Olympia Snowe, not just because she's from the same state, because you're both Republicans who sometimes vote with the Democrats. Would you have voted in favor, as she did, of the Baucus bill?
I have a lot of concerns about the Baucus bill. My concerns include that I think it could well drive up the cost of insurance for middle-income families. I think it unfairly penalizes small businesses when they hire low-income workers. And I don't think that it does enough to rein in costs. So I'd like to see a bipartisan alternative to the Finance Committee bill.
So you would have voted no?
Well, it's always difficult when you're not on a committee to say what you would have done in those circumstances. But the committee bill does not achieve the goals that I've set. I think it falls short in terms of reining in costs, and that should be one of the primary goals of a health care reform bill.
Then a lot of Republicans would be happy with what you're saying right now, Senator Collins, because cost is one thing that is on their mind. A lot of Republicans and some Democrats wondering how the heck this country is going to pay for health care reform. How do you think we are going to pay for it?
Well, one of my concerns about this bill is it pays for the bill by cutting Medicare by almost $500 billion. That's going to be really hard on hospitals, rural hospitals in Maine, other health care providers, and in some cases it could affect the prescription drug benefits of our seniors. So how this bill is paid for is a major issue. Another source of revenues are additional fees and penalties and taxes that are imposed on healthcare insurance companies, medical device manufacturers, small businesses, individuals who don't get insurance. I think that's a problem.
Let me ask you this, because Senator Snowe was on our show yesterday, and she acknowledged that she had been called by President Obama at least 8 times in recent weeks in an effort to try and get her to come over to the Democrat side. Have you been called by President Obama?
I've had conversations with the president and with his staff. Let me give Senator Snowe a lot of credit for improving the bill. She helped keep out a public option, which I also oppose. So I think she made the bill better than it would be, but I think it still has a long ways to go. It falls short of the goal of reining in costs.
Let's talk a little bit about tort reform. Will this be an absolute must for you to have that included?
I strongly support medical liability reform. The CBO has said that it would save $54 billion over the next 10 years. It's one of the few actions that we can take that we know will help to reduce costs by reducing frivolous lawsuits and also reducing defensive medicine that causes physicians to prescribe unnecessary tests. So yes, I think that would be a major improvement in the bill if that were added.
Senator, it seems to me like you would have voted no yesterday, even though you're not going on the record as saying such, which makes you different from your fellow senator from Maine. Susan Collins, thank you so much for being our guest this morning.
Thank you.